cut, color, and clarity. And no, I'm not talking about diamonds. I'm talking about 3 of the essential factors you need to know about when you are assessing your bowel movements. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. Last week, I told you about the importance of turning around and taking a look after you have a bowel movement. On today's show, I want to tell you the specific things you should be paying attention to when you turn around and take a look so that you can understand exactly what your stool is trying to tell you. Yes, your GI tract is communicating with you by giving you feedback through your stool. And I'm going to help you translate that because this communication is really important feedback and it can improve your health. It might even save your life. Your bowel movements can tip you off to the early signs of colon cancer, liver disease, infection. They can tell you whether you're dehydrated, have a parasite, or problems with your pancreas, not getting enough greens, eating too much meat, thyroid out of whack. Your stool gives you critical information to help you make those important changes that are going to make you look and feel and function better. So how do you figure out what your stool is telling you? And how do you know when you have achieved stool nirvana? When we come back, the 5 essential factors that you should be assessing. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation, backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. The first feature I want you to pay attention to is the color of your stool. Bile and dead red blood cells give stool its characteristic brown color. And pale, chalky stool can be a sign of liver disease or clogged bile ducts. And in that situation, it's often accompanied by dark urine. So your stool is light and chalky and your urine is dark. And that's because the bile is now getting excreted through the kidneys instead of the digestive tract in this situation of a clogged bile duct. But pale stool can also just mean that you're not eating enough green vegetables. And the truth is, most people who have pale stool, that is likely the reason. Not enough green vegetables, not liver disease or a clogged bile duct. But if you have pale, chalky stool plus dark urine, you definitely need to get that evaluated. Yellow stool can mean a parasite, especially parasites like Giardia, and it can also mean excess fat in the stool because your pancreas is not secreting enough enzymes. Green stool, characteristic of something called Clostridium difficile. It's bacteria that's often picked up in the hospital, or antibiotics can also turn your stool green. Red stool, that is usually from bleeding lower down in the intestinal tract. So red stool, if it's from blood, it's usually blood in the colon, not from up in the stomach. That's black stool, higher up in the GI tract. But you can also see red stool if you've been eating a lot of beets. So red stool within 24 hours of eating beets could be that. I mentioned black stool. So again, bleeding higher up in the GI tract or from an iron supplement that can also turn your stool black. A lighter brown color, just like the pale chalky stool, probably not eating enough deeply pigmented leafy greens. And believe it or not, blue food coloring can actually turn your stool blue. So when we talk about stool nirvana, when it comes to color, we're looking for a deep brown color that looks like melted chocolate. We don't want pale and we don't want black. So deep brown, melted chocolate, think somewhere between a milk and a dark chocolate. Okay, another really important characteristic, consistency. Your stool is 75% water, and dehydration is one of the commonest causes of hard stool that's difficult to pass. And keep in mind, you may not feel thirsty until you're already pretty dehydrated. So you need to make sure you're drinking at least half your body weight in ounces of water daily to keep your stool moist and easy to pass. If you weigh 150 pounds, that's 75 ounces. If you weigh 200 pounds, that's 100 ounces, but that's a minimum. And a couple more tips about consistency. Plant fiber in fruits and vegetables and beans is going to add bulk to your stool. And that is going to create a stool with a consistency that is much easier for your colon to push out. So if you are looking to have an amazing stool with an ideal consistency, here's what I recommend. Here's my recipe for that. Start out with a green smoothie in the morning. You can find my recipe for the gutless green smoothie on the website or in the show notes from last week's episode. And of course, feel free to put berries or a green apple in it, mango, pineapple, whatever fruit you like, but make sure there are lots of greens. And then for lunch, a split pea soup or a bean soup of some kind with a salad, and then lentils and brown rice for dinner. And you can definitely add some animal protein to lunch or dinner if that's your preference. But the smoothie, the split pea soup, the salad, the lentils, the brown rice, that is all going to give your stool amazing bulk and an ideal consistency. Stool that's too loose can be a sign of inflammation in your colon or infection with a virus, a bacteria, parasite that can all cause loose stool. Now, usually, if you have an infection, there are going to be some other signs too. You may have nausea, maybe you've been vomiting, maybe you have a fever, depending on what the pathogen is, but an abrupt change in the consistency of your stool where it's normally formed and all of a sudden it's loose, that really needs to be evaluated. Diabetes can cause loose stool when the nerves that control the motility of your GI tract are affected. But it can also cause the opposite. It can slow down transit time through the gut and cause constipation and hard stool. So it can be either too fast or too slow with diabetes. An underactive thyroid is associated with hard stool, so that's hypothyroidism. And an overactive thyroid, hyperthyroidism, is associated with loose stool. And believe it or not, a change in bowel habits is often one of the first manifestations of thyroid disease. The medicine cabinet is a great place to look if you are noticing a change in your stool consistency, if you have started a new medication. Narcotic pain relievers typically will cause hard stool and constipation, and then things like antibiotics, magnesium-containing antacids, diuretics will cause diarrhea. But lots of different medications, over-the-counter prescription and supplements can cause a change in stool consistency. I mentioned iron earlier, turning your stool black, and that will often also give you a harder stool. Loose stool can also be a sign of lactose intolerance or food allergies. So when it comes to stool nirvana for consistency, we are looking for a soft, bulky stool that sends a signal when you need to go, a strong signal, ideally in the morning, and that exits easily, but is not so loose that it is sort of falling out. When we come back, clarity, cut, and my favorite, clean up when we come back. We are back with more important information about what your stool is trying to tell you. I covered color and consistency, and now I'm going to talk about clarity. If you notice bits of corn or lettuce or other vegetable matter in your stool, that is often a sign of a normal, healthy plant-based diet. So that sort of undigested cellulose material, if you are eating enough plants, it is not abnormal to see that in your stool. But people with inflammatory conditions like Crohn's disease or ulcerative colitis or celiac disease may have a lot of undigested food particles in their stool because of malabsorption. And in those situations, there are usually additional symptoms like weight loss and diarrhea, blood in the stool, abdominal pain. But just seeing a little bit of vegetable matter in a normal-looking stool, that is not necessarily abnormal. It's a question I get asked a lot from people, particularly when people transition to a more plant-based diet, and often they're worried. But again, if everything else about the stool looks good, generally not a worrisome sign. Oily stools that float can be a sign of fat malabsorption, and that can be coming from a problem with your pancreas, liver, or gallbladder. Those are the three main organs that are involved in absorption of fat from your GI tract. In the case of pancreatic disease, there's almost always weight loss along with a fat malabsorption. So when it comes to stool nirvana, for clarity, I want to remind you that a little plant matter in your stool, particularly within 24 hours of eating it, is not abnormal. But we're looking for a stool that does not float. It sinks to the bottom of the bowl, and that is what we're looking for in terms of stool nirvana for clarity. Next on the list, cut. And yes, if you are sensing a diamond theme, you are correct. Just like we use cut, color, and clarity to assess diamonds, when it comes to stool, cut, color, clarity are important too. Your stool is also precious material, just like a diamond. Every time you hear that Rihanna song, Shine Bright Like a Diamond, I want you to think about your bowel movements. Okay, cut. Pencil-thin stools can be a worrisome sign. They can represent things like colon cancer, diverticulosis, or inflammation in the colon. But pencil-thin stools can also occur simply because you don't have enough fiber in your diet. If you have a sudden change where your stools were a normal caliber and now they're super thin, that definitely needs to be evaluated. Small pebble-type stools are very typical of diverticulosis, and they represent casts of the diverticular pothole where the stool has been sitting. Not enough fiber in your diet can also result in pebbly stools. And to take it full circle, not enough fiber in your diet can also cause diverticulosis. In fact, many of the things that can go wrong in your colon are caused by not enough fiber. Stool that has been sitting in your colon a long time waiting to come out can form layers of varying colors. I call them concretions. It looks like, volcanic rock, and you can see the different striated layers. And sometimes those stools can be large and painful to pass because they have dried out from sitting in your colon a long time. So, if you're going days in between bowel movements, this may be something you're experiencing. And when the stool has been sitting in the colon a long time, a lot of the fluid in the stool is going to get reabsorbed from the stool back through the lining of the colon, and that is going to give you a hard, dry stool. If you are someone who tends to squeeze your anal sphincter prematurely when you're having a bowel movement, before all the stool has a chance to exit, it can pinch off your stool and it can give it a sausage on a string appearance. That sounds lovely, right? And because I'm a gastroenterologist, I am, of course, using a food analogy, the sausage analogy, to talk about the appearance of your stool. But it's an important thing to consider, particularly if you are rushing. So you're on the toilet and you're in a big hurry and you're not really relaxing and giving the stool a chance to completely exit, and you sort of contract that sphincter and it pinches it off, and there may be more stool that comes out in this sort of additional sausage with a tapered end. So I want you to make sure that you are giving yourself enough time whenever you're having a bowel movement to make sure that it is all exiting. When it comes to stool nirvana for cut, we are looking for a thick stool, at least the diameter of a nice big banana, and ideally the diameter of a plantain, which is a banana's first cousin and is typically larger. And, several inches long, ideally. You don't want that little, 1 to 2 inch sausage on a string appearance. I think last week, Janet and I talked about the velvet rope bowel movement, and I just want to thank Rocky for that. Okay, a final analysis of bowel movements involves cleanup. A stool that leaves no messy residue when it exits. It's what I like to call the clean wipe. And that is characteristic of a very high fiber diet, which is why in parts of the world where they eat large amounts of fiber and have, big stools the size of my head, they sometimes don't even require toilet paper because the stool is exiting in this clean way with no messy residue. This ideal stool often also does not have a bad odor or much odor at all, and you definitely don't need to be spraying room deodorizer afterwards, although if you are consuming cruciferous vegetables like cabbage and broccoli and cauliflower and some types of beans and even dried fruit, that can cause smelly gas because of incomplete digestion, which is, again, a good thing here. You're eating a lot of fiber that's not completely digested because it's not there for you. It's there to feed your gut microbes. And then there's additional fermentation by those gut microbes. And that can result in sometimes kind of, smelly stool. Foul-smelling stool can also be a result of something called bacterial overgrowth. You've heard of SIBO, small intestinal bacterial overgrowth. I think I did 2 episodes on that in the podcast. Inflammation in the GI tract can cause foul-smelling stool. Last week, I talked about how I can smell the pus in somebody who has active inflammatory bowel disease before I even see it. An infection, rotavirus infection in particular, smells really terrible. I can smell it from across the emergency room. Too many sulfur-containing foods, chemicals, artificial flavoring in food, lactose intolerance, or too much processed meat in your diet. That can all give you really sort of nasty smelling stool. So when we think about stool nirvana for cleanup, we're looking for a relatively odorless stool, with a caveat that if you're eating lots of cruciferous vegetables, that is probably not going to be the case. But we're looking for a clean wipe with no messy residue. And there you have it, the 5 essential factors for analyzing your stool: color, consistency, clarity, cut, and cleanup. I want to leave you with 3 takeaways about stool nirvana. Number 1, turning around and taking a look is one of the most important things you can do for your gut health. If you do it regularly, you will probably never need to come and see me. Number 2, what comes out in the bowl is a reflection of what is going in to your mouth, how much fiber and water you're consuming, but it's also a reflection of what else is happening in your body. If you have a change in your bowel habits, like new onset constipation, or looser stool than normal, or blood in your stool, or pencil thin stools, you definitely need to get that evaluated. Do not sit around pondering that. Number 3, I want you to be a medical detective when it comes to your gut health. And that starts with being an expert on your own bowel movements. So I want you turning around and taking a look every single time you have a bowel movement. So that's it for this edition of the Gut Bliss podcast on stool nirvana and the 5 essential factors you should be assessing when you turn around and take a look. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.